reticulocyte count is nothing but immature RBC with RNA residues in it. It reflects bone marrow activity. Corrected reticulocyte count is important to know the correct bone marrow activity. It is calculated with reticulocyte into hematocrit of patient by hematocrit of normal person. Reticulocyte production index is equal to corrected reticulocyte by maturation factor. The maturation factor is, if hematocrit is normal, that is 40 to 45, it is 1. If it is 35, it is 1.5. If it is 25, it is 2. If it is 15, 2. It is 2.5. So reticulocyte production index is calculated this way. If suppose hematocrit is 25 and reticulocyte is 4%, here the maturation factor is 2. Since hematocrit is 2, the corrected reticulocyte will be reticulocyte count into hematocrit of patient by normal hematocrit, that is 4 into 25 by 45, which comes out to be 2.2. Now if we calculate the reticulocyte production index, it will be CRC by maturation factor, that is 2.2 by 2. That is 1, comes out to be 1.1. If reticulocyte production index is less than, if it is more than 2, that means the marrow is bone marrow is adequately compensating for anemia. That is, the bone marrow is working good in compensating the present anemia. If so, the anemia might be due to hemolysis or blood loss. If the hematocrit is, that is, if the reticulocyte production index is less than 2, it is due to inadequate bone marrow response to the anemia. In that case, the anemia is due to low RBC production, which may be due to nutritional deficiency like reduced iron, B12 or B9, or bone marrow suppression, or anemia of chronic disease. In chronic disease, due to interleukin 6 and tumor necrotic factor alpha, they increase the hepcidin that traps the iron in macrophages and suppress erythropoietin production. That ultimately, even though iron is present, it is unavailable by marrow to produce RBC. That's how it causes anemia. That is why it is called anemia of chronic disease.